course, I met Dr. Dellon when I first interviewed for peripheral nerve surgery. I had been a medical student at Johns Hopkins. He was a physician working as a adjunct faculty with Johns Hopkins. So I finished my residencies, 7 years of training, and then I met Lee Dellon interviewing for a fellowship program. I just found him to be very intriguing. He was engaged in a field of plastic surgery that I had never seen other than for carpal tunnel surgery or just to repair a cut nerve. He had this entire realm of surgical procedures that he had helped craft, if not crafted from scratch, with techniques. He'd written hundreds of papers, literally hundreds of papers. And then when I met him at my interview, he actually physically helped me through email communications, as I was trying to treat a patient at the VA hospital in Birmingham, Alabama. And I was hooked. He provides sort of the perfect balance of hands-on, do-it-yourself work with guidance and mentorship, and learning from his skills and his techniques and the procedures he designed himself, and just the knowledge that he had created. For those next 2 years, I was working side by side with Lee Dellon on my own completely, but when things didn't go the way we expected them to, or I had important questions of what would you do in this person, how would you examine this person, what are you looking for, what am I missing, I had the wonderful opportunity for 2 full additional years to pick his brains, bring him into the operating room, bring him into the clinic room. And that was, again, just a true blessing. So after those 3 years, essentially I became a partner in the practice of the Dellon Institute for Peripheral Nerve Surgery in Baltimore, where I currently am, and was on my own, running my own practice. I had the opportunity to help Dr. Dellon with several training courses, training podiatrists in peripheral nerve surgery in the foot and ankle. Had some opportunities to speak at some of the medical conferences to help him with a book and some publications, and also with some dissection and teaching at a cadaver course for joint denervation. I had basically extensive, unfettered access to Dr. Dellon over the years, and hope I took advantage of that. Really just a blessed time of really having the opportunity to pick the brains of one of our world experts in peripheral nerve surgery, but we see less of him around in the office now. I've taken over the office completely, and I am in, this is my practice now. And we have continued to try to continue his legacy as the Dellon Institute in Baltimore.